Hi, Dr. Rodman, and I am going to talk to you about what to expect after an Adam's apple reduction. Adam's apple reduction is also known as a tracheal shave, but that's actually a misnomer because I am not touching the trachea or doing anything to the trachea. Adam's apple reduction is a reduction of the thyroid notch, which is a little depression in the thyroid cartilage. This procedure is done through a small incision in the neck. Patients who are having a Renuvion or liposuction, I will use the same incision that I used under the chin for the other procedure. Patients who are just having the Adam's apple reduction, I will make a small incision in the highest crease of the neck as a means to hide that scar. All that manipulation of the muscles and the cartilages of the neck will make it a little hard to swallow the next day. There's no harm in swallowing. Patients are able to eat whatever they want, but they should expect some degree of difficulty swallowing and a bit of a raspy voice. Now, the vocal cords are not disrupted during the surgery. This raspiness or kind of harshness to the voice is because of the breathing tube rubbing on the vocal cords during manipulation of the voice box. Generally, this goes away within a week or two. After an Adam's apple reduction, it is important for the patients to perform scar care. Although it's a small scar, it's generally 1.5 to 2 centimeters big. The better the patient takes care of the scar, the better it will heal and the more invisible it will become. Generally recommend that patients put Aquaphor or Vaseline on the incision while the stitches are in and for about a week after the stitches come out, for a total of 2 weeks. After that, patients should apply scar strips or a scar gel and sunscreen to the area. This will ensure that it heals as well as possible, and by about a year, it'll be almost invisible. Just an Adam's apple reduction does not permanently affect the voice of a patient. There are other surgeries, such as the feminization laryngoplasty and other voice surgeries that do change the voice. But the Adam's apple reduction that I perform, the goal is just to remove the lump in the throat, the Adam's apple, not to change the voice in any way.